Up next, an effort to identify and treat mental illness is met with strong support in the Senate DFL. Senator Kathy Sheran introduced her legislation that would set up a relationship between schools and mental health providers. She explained in a news conference earlier today the details. Our coverage continues with her proposal.
Sometimes the root cause of violence can be contributed, sometimes, to unrecognized or undertreated mental illness. The initiatives that I am introducing, along with others who are here by this legislation, are related to untreated mental illness or the need for early recognition and intervention in serious symptoms of mental illness when they emerge. The initiatives deal with the lack of support for the mentally ill, for their families, in dealing with children who first have breakthrough symptoms that can lead to much more serious problems in later life. This proposal expands school-linked mental health services and will provide early intervention and connection to treatment that will help serve more children than have ever been served before, many of whom have never had contact because of the lack of resources with the mental health system. It is in a school-linked grant program that, with early identification of symptoms and early intervention and creation of a coordinated support service for that child and their family, that we will be able to help prevent the progression and deterioration to more severe symptoms of mental illness.
And it's not only the mental health professionals that you have in your building that are working directly with students, but when you have problems within the family, when you have a death of a parent, when you have a death of a student, that affects everyone within that school community. And being able to have professionals there to deal with those issues, to work with students, to work with families is really critical.
Bullying is another issue of a concern in the schools. And in terms of the development, psychological and chemical development of the brain, and the problem-solving capacity of adolescents because of their age, the options, what they see, first of all, they can't see into the future. They have not enough background or history to anticipate that things are going to get better. So they're high risk for suicide and they're high risk for violence because they don't see other options and possibilities for them in the future. So in context of talking about interventions with guns, interventions with early intervention for mental illness, we also have to talk about what we're doing in our society as voyeurs of violence, and also what we are not doing in order to address environmental factors in our schools that create this sense of hopelessness.